Hi, my name is Olivia Burnett, and today I'll be talking to you about breaking the stigma and challenging perceptions of substance abuse. So to start, what is substance abuse? Substance abuse is a public health issue that deals with the harmful use of psychoactive substances such as drugs and alcohol. The abuse of these substances has led to many mental and physical health issues, and public health initiatives can help to create initiatives that concentrate on stigma reduction, treatment, and preventative techniques to address this issue. As far as the magnitude, substance abuse has a global effect. People all around the world are affected by substance abuse, and as according to the UNODC drug report of 2022, 296 million people use drugs globally, and this is about 5.8% of the global population. And as far as the distribution, this public health issue exhibits significant geographic disparities and is influenced by socioeconomic factors, cultural norms, and the types of substances involved. It disproportionately affects various groups, including adolescents, individuals from lower income backgrounds, minority population, and those with a history of mental health issues. So we have some risk factors here. So there are numerous risk factors that contribute to an individual's susceptibility to drug abuse and addiction. Here are some of them. The first one is socioeconomic status. So socioeconomic factors encompass income, education, and access to different resources. People from lower income backgrounds often face an increased risk of substance abuse, and this is important in understanding the socioeconomic status influence on substance abuse, which will help us to identify at-risk populations and tailor interventions to address economic disparities. Next is psychological factors. These factors include a history of mental health issues, emotional trauma, and coping difficulties. They can contribute to a higher risk of substance abuse in many individuals. It is important in recognizing the impact of psychological factors, as this is essential for providing comprehensive mental health support and addiction treatment. Next is genetics. So genetic predisposition can make specific individuals more susceptible to addiction. Family history may play a role in an individual's likelihood of substance abuse. It's important in identifying genetic factors because they help to personalize prevention and treatment strategies and improve our understanding of addiction's biological basis. Lastly is stress and coping mechanisms. High stress levels and ineffective coping mechanisms can lead individuals to turn substances as a way to escape or self-medicate. This is important in addressing stress management and promoting healthy coping strategies, as it is crucial in reducing the risk of substance abuse and relapse for those who are in recovery. So this is important why. The opioid crisis is of foremost importance because it has rapidly escalated across numerous states in the United States, leading to the unprecedented levels of addiction, overdose deaths, and societal devastation. It has not only strained healthcare systems and law enforcement, but has also shattered countless families and communities, which caused them to demand urgent and comprehensive responses to prevent further losses of life and to mitigate its far-reaching impacts. So where does this occur? According to the CDC, West Virginia, Tennessee, Kentucky, and Louisiana stand out as the states with the highest opioid-related mortality rates in the nation. Each reported death rates surpassing 50 per 100,000 population. So, and then another thing that's important to keep in mind are the consequences. The opioid crisis's profound impact extends beyond the loss of life. It has led to a worrisome overflow in the spread of transmittable diseases due to unsafe injection practices. Additionally, the crisis has eroded the prestige of healthcare systems as they struggle with the overwhelming burden of addiction-related cases. Therefore, many afflicted communities experience a decline in overall health, as the crisis puts a toll on the social fabric and economic stability, worsening health disparities and socioeconomic challenges. So the last thing that we're going to talk about is how we can help. We have the power to lessen the stigma associated with drug use by encouraging compassion, understanding, and candid communication. By redefining addiction as a medical condition rather than a moral failing, we can help people get the care and rehabilitation they need without worrying about being judged or shamed. In addition to encouraging educational programs, this will help to dispel any myths and increase the understanding of the complexity of addiction and its causes, and can aid in the fight against stereotypes and lead to a society that is more understanding and encouraging overall. Two questions to consider. The first one is, how can a comprehensive approach to drug abuse as a public health issue be integrated into healthcare systems and communities to effectively prevent, treat, and support those who have been affected? And secondly, what is the impact of substance abuse on vulnerable populations, such as the homeless LGBTQ plus community and those with traumatic histories and young adults? Here are just some references, and that's it. Thank you.